Depression is an incredible complex condition, as is any mental health. We don't really understand the brain as well as we should, and no one told me that depression could be terminal. And I wish somebody would have warned me.
I was riding with the police officer and I asked, what are the calls that concern you the most as a police officer? And I thought it would be armed robberies or burglaries, and what he really said was, it's the IDs, the immediate detentions. When someone is in such a mental crisis, mental health crisis, that they are either going to do harm to themselves or harm to someone else. And in my ignorance, I asked, well, how often can that possibly happen? And he told me that it happens almost once a shift. And that kind of startled me, and it started this entire journey that myself and the city and others went on to try to discover what's going on in our community and how we can make it better.
In order to address that kind of concern, it takes time, it takes people to come together, and then to come to grips with whether we have the resources internally or whether we need to turn to outside providers.
So we're partnering with Community Hospital and their staff to create a set of protocols that our people can follow to treat the patient in the field, but also reach back to that mental health professional over a cell phone to be able to treat those patients more effectively.
Because our goal is to not only help people in crisis, but also prevent that next crisis. And while we don't have the skill set to always, counsel them on that future crisis, we can point them to the resources in our community that can help them.
When I heard my daughter tell me, as I asked her why she was sad every day, she said, "Dad, I don't know. I have everything I want in life. I'm sad." That's the real definition of depression, is when you're sad when everything's going right. It's not when you're sad and everything's going wrong. So I decided that we needed a venue for us to create a platform for education, for awareness, so that we could work with the schools, work with the city, and work with the general community on getting awareness out there around mental health, and try really hard to prevent suicide from happening so that other families don't have to go through what we've had to go through.
Mental illness is an illness like any other illness. It's very treatable, so it's very important that we educate ourselves and help connect the community together to build a better infrastructure to support people that are in need.
At the end of the day, if we can help one person who is living what I would say in quiet despair, if we can reach out to them and help them through the services and the collaboration that we've come up with, then I think that's a success.